was a year ago this week that Boris Johnson addressed the nation from Downing Street and made that announcement which would impact our lives and liberty in ways many of us just would never have predicted.
So, 12 months on, how has the government responded to the worst national crisis in decades? Joining us to discuss this is the former president of the UK Faculty of Public Health, Professor John Ashton. We have the Chair of Global Public Health at the University of Edinburgh, Professor Devi Sridhar, and Professor of Oncology at St George's Hospital, Angus Dalgleish. Good morning to all of you. Thank you for joining us this morning. If we can start with you, Professor John Ashton. You were on Question Time, I think, about a year ago, and you were predicting some pretty worrying things. The crisis in care homes, prison outbreaks, the government, as you suggested at the time, believing its own rhetoric. I think you faced a lot of criticism off the back of that, but it seems like a year on, you've been clearly vindicated.
Well, sadly, yes. It just gives me no pleasure. You know, it's all here in the book, Blinded by Corona, which describes all of the sins of omission and commission. I mean, the only thing really that the government's got right is the vaccination programme, which is a fantastic success. I think the government would say, you know, it's managed the pandemic to their own satisfaction. That's how their assessment would be, I think. 100
or more than 125,000 deaths. I mean, the death toll is appalling. It's absolutely staggering. Professor Devi Sridhar, when you look back at the mistakes that were made, at what point could the government have shifted its position and lowered the death toll?
Well, I think the time to move was really in late February when we saw what was happening in Italy. It was clear this was a virus that was not like the flu, that would overwhelm our health services and that would kill a lot of people. So that was the time to start running. And unfortunately, we wasted a month not really preparing for what was ahead and trying to avoid the hard decisions that were to come. And many people paid the price, not only then, but again in the fall with the September lockdown being delayed. And then over Christmas, we can see all the deaths that we faced in January and February from, again, not moving quick enough at Christmas to actually make sure people knew the risks ahead.
Professor Ashton, when should we have gone into lockdown? It's exactly a year ago this week that we did. But when should we have done, and what impact would that have had?
Well, there's two sides to that, really. If we'd got on top of testing and tracing at the very beginning, we may not have needed to lock down, and certainly not lock down the whole country at that time. In the end, though, we locked down too late, and as you've already mentioned, really, we then eased off too soon, and at each stage we've done the wrong thing. We've let down too late, eased off too early, encouraged everybody to go eating, drinking and shopping during the summer to let the virus keep circulating, ignored the advice to have a fire break in October half term, encouraged people to think of a normal Christmas and then had to backtrack, and we saw what happened in January. And now we've got the same thing coming up where people are being encouraged to think of having a normal summer holiday in Europe. But unless we are able to vaccinate the world and vaccinate the whole of Europe, as Dr. Hillary's just mentioned, I'm afraid the summer holidays are going to be off as well.
Professor Dalgleish, the government will argue, of course, they've been listening to the science all the way through. They've been taking advice from their scientists. What do you make of that response, and what do you make of the position of our scientists within the pandemic response?
Well, I agree with the major comments that have been made with regards to how the initial part was handled. And the vaccine, of course, the vaccine initiative has been handled remarkably well, mainly because I think that they had the sense to commission several vaccines and go with the ones that were looking very good. And we mustn't forget that quite a few vaccines failed, GSK, Sanofi, Australia, etc. So that was good. But from a clinician's point of view, I think there was a marked lack of pragmatism. The idea of telling everybody to stay at home, not go out, to protect the NHS, to save lives, I think was extremely flawed without the added advice of saying how to deal with. This is an upper respiratory disease. You could probably pick up off surfaces too, but we didn't know really what it was, but we do know how to deal with upper respiratory diseases as they come along. We know that, first of all, that vitamin D deficiency is absolutely widespread throughout this country, and that it does protect from flu and all sorts of upper respiratory diseases. I personally was lobbying that they should give everybody vitamin D right from the beginning, because if they did get the infection, they wouldn't die. The facts and figures are quite amazing. If you go into hospital and you've got a healthy vitamin D level, and you have very little chance of dying, even though you're ill in hospital. If it's below 30, you've got a 70% chance of dying if you have to go to hospital because you're short of breath. And then we have the people who are at risk, people who have darker skins. We know that their vitamin D is much more likely to be below 30. So why did we not address it? Other simple little things. We've known that aspirin is incredibly useful to damp down. If you get a virus in your upper airway, like this virus we know does, latches onto these cells. Well, aspirin is a very good at inhibiting with the inflammatory pathways.
Professor Gleesh, we'll talk about those measures in just a moment, because there haven't been, as you say, you know, the health messaging in some cases has been mixed. But I just want to talk to you about the knock-on impact of the lockdown on other things. Because one of the major criticisms of the government is it didn't go into lockdown early enough, and it didn't last long enough, and it wasn't enforced strictly enough, for instance, over Christmas. But there are people who have been damaged by lockdown because of, for instance, their cancer wasn't treated properly, or people were too scared to go to the NHS because they were told to stay at home to protect the NHS. What questions does the government have to answer over the impact of lockdown and how it sent out the health messages on other diseases?
And I totally agree with this. They've basically been focused on the number of cases and the number of deaths. Well, I think now as an oncologist, as a practicing oncologist, we're probably going to see more people die as a result of lockdown than 120,000 people who've died to date, many of whom would have died at any rate in the near future. But as an oncologist, we have seen an enormous number, 400,000 people have not had the necessary tests that they should have had. 40,000 haven't started their treatment in time because of delay after delay, and they've gone from being curable to people who are going to be living with cancer and dying early from cancer. And that is just cancer. It goes back, I saw there's 100,000 people who should have had stents for heart disease. This is quite incredible. If you need a stent for heart disease and you don't have it, you're going to very likely die. And it goes on and on. And the real devastating impact of this is on mental health. The number of people who've just been going quietly mad, unable to access particular one-to-one treatment that they need. I mean, and I saw that, the deaths from dementia with COVID aside have increased by a quarter of what more than one be expected. And of course, we know why. They weren't getting the human contact that we need so much, that we all need so much. And this has gone on to all the just daily lives, the routine, the economy, everything has been damped down.
The impact of lockdown
That's aside from the kids not going to school as well, isn't it? I mean, the fact that the children have missed out. I wonder, Professor John Ashton, we had Michael Rosen on earlier, the author and writer who himself was on a ventilator for 6 weeks and is still suffering. He has sort of a blindness in one eye, he has hearing issues, all sorts of problems, calling for an inquiry now. He wants an inquiry. He feels the government have failed us. Why is the government saying it's too early for an inquiry? Are they hiding behind that as an excuse because of all the things that we've been listing this morning that they got wrong?
Well, yes, and I've just read in the Times this morning that this inquiry is going to go the same way as the inquiry into the shootings in Londonderry all those years ago. And it's likely not to report until well after the next general election. This is what's called kicking into the long grass so that Boris Johnson can try and retrieve his reputation and walk away and be off the pitch before we find the detail.
Professor Devi Sridhar, fantastic news this morning from this survey, trial over in the States. The Oxford AstraZeneca vaccine, 79% effective at preventing COVID-19, offers 100% protection against severe disease. That is new data that will boost confidence in the vaccine. But can you reflect on that, but also on Professor Gleesh's comments about the fact that there were other simple health measures that the government might have been clearer on, which may have boosted our immunity or better treatments?
Yeah, I think looking ahead, it's really reassuring to see the AstraZeneca details out of the United States. AstraZeneca is safe, it's effective. If you're offered it, you should take it. And vaccines are our way through this. Right now, it's a race between vaccinating enough people and actually trying to lift restrictions in a balanced way. We don't want to trigger a third wave by releasing restrictions too quickly when we know there are a lot of people in their 30s, 40s, 50s who are still not yet vaccinated. But I think it should reassure people about AstraZeneca. I know there have been concerns and people not showing up for appointments because of that. And yes, I mean, clear messaging. A lot of the countries that never locked down, their secret was three things. The first was actually border measures, so strict border restrictions, which I know we struggled with in Britain because we are so integrated. The second was test, trace, isolate, actually having a functioning system. We've spent 37 billion and we don't have a functioning system. That's something to look at. And the third is actually messaging, as the professor was saying, actually clear messaging to people about hygiene, about the aerosol dimensions, about how the virus spreads, about, being healthy. I think this has revealed also, how unhealthy a large part of the population is and why we need to look into investing and, improving people's public health. But I think the thing for me in my mind is the words never again. We can never again go through this with another pandemic. And there will be others coming in the next few years, in the next 10 years. So how do we look ahead and say never again will we repeat this years in terms of restrictions, in terms of deaths, in terms of health service collapse? What are the lessons we need to learn? And how do we make sure that in the future we look more like, some of those East Asian countries and don't end up with the death toll that we faced?